I'm going to demonstrate today 3 different secure text messaging scenarios using MicroBlogging MD. The first scenario, logged in as a nurse by the name of Jane Smith. I'm going to ask for a consult to a physician by the name of Dwayne Sanfrangelico. First of all, I'm going to go ahead and tap the message option out of MicroBlogging MD, and now I'm going to identify or find the physician I want to send this message off to just by typing the physician's name. And quickly I've identified this doctor, his name is Dwayne Sanfrangelico, that I'm going to send the message to. Notice also on the left-hand side of this physician's name is a bell. That's an indicator to the person sending the message that this doctor is actually on duty and currently receiving text messages. I'm going to select the physician, and in the body of the message I'm going to use a keyword or a template to generate the message as opposed to just typing or using voice recognition, all of which you can use generating a message for MicroBlogging MD. So as I type the keyword, I'm going to hit the space bar and it's going to explode whatever block of text has been associated with that template. Notice also I've put a telephone number actually in this template or in this message, and I'm going to point out what happens from the physician perspective as well as what you see in the message when the doctor actually taps on that phone number in just a second. So now I've sent the message off to the physician, and what's nice here is MicroBlogging MD takes me directly into the conversation as I wait for this physician to respond. The doctor's now received the text message from me, and as he joins the conversation, I want to point out a subtlety here. Notice that I now receive a notification that this doctor is actually entered in the conversation. In addition to that, when the doctor responds, I'm going to receive the text message back from the physician. And then lastly, if the doctor chooses to call the phone number that's contained in the message, I'm going to receive notification that the doctor's dialed that particular number. Now what's nice about that is the arrival notification and the dialing of the phone number notification. The doctor didn't have to send anything to me in order for me to receive that notification. So there's very nice auditing capabilities built directly into the application, and the doctor has to do very little to respond to that original message I sent out to him or to her. Okay, so that's the first scenario in MicroBlogging MD.